Dr. Kevin Campbell is here with us to tell us more. So who is at risk at the most?
So the risk factors for breast cancer are, age greater than 55, Caucasian women, certainly, family history of breast cancer, and also if you have dense breast tissue. There's certain gene mutations in your DNA called BRCA1 and BRCA2 that also put you at very high risk for breast cancer.
So they can test for that?
They sure can test for that. And then you can go through genetic counseling and make some tough decisions about, some type of prophylactic mastectomy or other type of, procedure you may want to have done based on that.
And it's one of those cancers, as you mentioned, genetics, but genetics really plays a big role in breast cancer, doesn't it?
It absolutely does. If you have a family history of breast cancer, you are twice as likely to have breast cancer yourself. And certainly we know that there are other high-risk behaviors that we can modify, such as obesity, such as a sedentary lifestyle, alcohol use. Those types of things actually increase your risk for breast cancer as well. And those are things that we can do something about.
All right, so there's a lot of research that's gone into this kind of cancer for decades now. Are we any closer at all to a cure?
Certainly it's very encouraging that our survival rates now are, 100% almost for stage 1. Stage 2 is around 95%, stage 3, 70%, and stage 4, around 25%. But what we know is that we're getting better and better with these therapies, and I think as we become more advanced and do more research, we're going to individualize chemotherapy like you've heard about, where we do personalized medicine and match your drug to your breast cancer type. And I think that we are, going to see a breakthrough.
And immunotherapy is playing a huge role in what the future may look like for cancer research and combating cancer as well.
That's absolutely right. We're so fortunate to live in this area with major academic medical centers like UNC, like Duke, that are doing cutting-edge research in this area. So I think in the next 5 to 10 years, we're going to make even more significant progress, and hopefully we'll eliminate this cancer altogether.
And one last question for you. We can't forget men in this conversation either, because they also get breast cancer. People might not be aware of that.
That's exactly right. Men can get breast cancer. It's certainly a lower rate than women, and it's fairly rare, but it's something that can be life-threatening to men as well, and we need to be aware of it.
All right, thanks so much for coming in today.
Thanks so